You are listening to Health Matters Podcast by Physio First Phuket. Your health, your future. In this podcast, we dive into all things health, covering physiotherapy, traditional Chinese medicine, nutrition, and much more. Stay tuned for expert insight and practical tips to help you live your best life. Hi everyone, welcome back to Health Matter Podcast. Today with me, Mimi, physiotherapist at Physio First Phuket. Normally, we're always talking about health in physiotherapy and Chinese medicine. But today, we have a special thing that we always overlook about this is about nutrition. And also for people after surgery, mostly we overlook on nutrition. We do rehab, maybe get enough sleep, but nutrition, I don't think we get deep down about that. And I'm really excited today to talk about this topic with the expert. So please welcome Bali, the dietitian.
Hi everyone, my name is Bali. I'm a specialist dietitian from the UK and here with Physio First Phuket, who have been very warm and gracious in welcoming me today, and looking forward to talking about nutrition post-surgery.
Okay, so the first thing is normally people after surgery or post-operation, they get a medicine from the doctor and some client do the rehab, but not so many people talking about nutrition. Before we go over that, can you explain a bit about what happened during after the surgery in the body?
Yeah, really good question. So actually, when you're going for a surgery, we like to think of the nutrition in the short period just before the surgery, so even a week before the surgery.
Yeah.
And then you have your first phase just after the surgery as well. So there's two parts to nutrition in that aspect, and that's the way we like to deliver the care when it's done properly.
Yeah.
Because when you have a surgery, it induces this thing that causes inflammation and catabolism in the body. Because imagine your body has an injury and it's not well, you're then put to sleep,
Yeah.
and then somebody gets a knife, cuts you open,
Yeah.
starts playing around with the things inside your joints or your organs.
Yeah.
Now actually this is going to put a lot of stress on your body. Now we know when your body is stressed, one of the first thing it needs is energy. And where do we get our energy from? It comes from the food that we eat. So actually the biggest thing that we overlook in surgery nutrition is that when we're coming up to surgery and after surgery, your body needs more than what you normally need. And that's the biggest thing that people forget, because actually to recover and for the wound to heal and for all the immune system to work properly, you need to give your body enough money to pay all of the bills.
Yeah.
And this is what happens where people don't eat enough. Actually, we can delay how quickly and how efficiently the healing process happens.
Yeah.
When that's delayed, it actually then impacts the physiotherapy recovery.
Yeah.
Because they don't have enough energy.
That's correct.
To do the rehabilitation, to do the exercises, or they don't have enough energy to rebuild the muscle that they have lost.
So when talking about you need more energy, you need to eat more food. Can you specific, some people I can eat more this time.
Yeah.
What kind of food is really important in this phase, and how much more, how many percent more than normal?
That's a good question. So now let's think of it. So let's say the day before your surgery, we try to increase the amount of carbohydrates and protein that you have, because your muscles and your liver can store extra energy as glycogen.
Yeah.
Now when you have your surgery, your body is put to sleep, and sometimes you don't eat for 6, 12, even 24 hours.
Yeah.
So where do you get that energy from? It comes from your stored energy. So before the surgery, we try to increase the amount of energy you've got stored. Similar when you do a marathon, you do a carbohydrate loading for the marathon.
Yeah.
Similar with surgery, you want to load some carbohydrates before. So then when you have your surgery, your body has some energy that you can pick at first. Then what happens is your body wants additional protein to help heal some of the wounds, to feed the immune system, and to help reduce some of that natural inflammation that is occurring. Now, where are the biggest stores of protein in your body?
Muscles.
Your muscles, exactly. So your muscles are your biggest stores of energy and protein. So what happens is your body starts thinking, I need more protein and fast to help deal with this injury and inflammation that we've caused.
Yeah.
So it starts to use and prefer the muscle as energy.
Yeah.
So that's why you see when somebody has an injury, they lose a lot of the size of the muscle really fast.
A lot.
Now, we can't always avoid this,
Yeah.
but we can minimize this. So somebody might still lose some muscle,
Yeah.
but if they have a good nutrition, they may only lose 2 or 3%. If they have very poor nutrition, they may lose 5, 6, 7, 8, 9, 10, up to 20%.
I see.
Okay.
Actually, it's not just only after the surgery. You have to prepare even before the surgery.
Exactly. Yes.
That's because I experienced, I think, all of the client, because they're losing a lot of size.
Yeah.
And then try to get back, try to work a lot to get that come back. Because as a physio, as a rehab team, when we're not moving, maybe 2 weeks, we lose strength already. So I think when you already like not moving a lot, you lose that already, and then plus with not enough nutrition, it's even worse.
Yeah.
Okay, I think it's really good information, because people thinking like, oh, I don't want to do this surgery. People are scared. Actually, if you prepare yourself, that's really good information. So, okay, up to the next question. So, how about people? Okay, if they already prepared themselves before the surgery, and then after surgery, some people like, okay, the protein intake, I have to take this or more food. How about people like, I don't feel good after the surgery? What should I do to get to the maximum that I should eat after the surgery?
That's good. Yeah, good question, because after surgery, it's very hard to eat. The painkillers, the anesthesia can make your gut slow down, can cause constipation, you can be dehydrated. Things take a few days to get back into motion and rhythm, and you're immobilized, your mood can be low, because post surgery you can feel as though you're a bit sad or frustrated because you can't move your limb as much.
Definitely.
So this makes it very challenging to then eat enough. The medications can make your appetite go low. Also, your liver is working very hard. So after surgery, you have an increase in gluconeogenesis, which increases the amount of glucose the liver produces, because the immune system needs carbohydrates and sugar to heal and to fuel. So your liver works harder, and it reduces insulin sensitivity, so your body can use the glucose more efficiently. So actually after surgery, we like to keep glucose running a little bit higher, just a little bit, to make sure your body is getting enough food and fuel.
I see.
So but when your insulin is running, when your insulin sensitivity is low and your glucose is higher and you're not used to it, you can feel thirsty, lethargic, low energy. So actually these things can impact how much you want to eat and drink. So what I recommend actually is after surgery is have something very light, okay? So something high in fast carbohydrates, because you want to quickly replenish the carbohydrates you've just used. So, and you want to recover your appetite fast. So sometimes that can be something a little bit sweet is nice. Some fruit juice is good. A glass of milkshake or protein shake is nice.
No cake.
I avoid very high fat food, because your gut is slowing down and it takes a lot for your body to digest fat, and it's a lot slower digestion. So it's more likely to make you feel more sick.
I see.
So actually you want something very light. So even if you just have a few Haribos or Jelly Babies first, and then maybe have a protein shake afterwards, is good after surgery. And then your first meal should be low fiber, high protein, and a little bit of carbohydrates. So you could have something like chicken and rice. It's a good meal to have after surgery. Because easily to digest.
I see.
Not too heavy.
Not too heavy.
And overcoming all of those other symptoms that you're having as well. The second thing then after the surgery is trying to get the water intake up, because you're a little bit dehydrated.
Yeah.
So you have to try and drink maybe a little bit more water.
Okay.
And that's maybe day 1 and day 2. I normally recommend try and have 6 small meals.
6 small, like break.
Yeah.
6 small meals.
So small breakfast,
Uh,
snack, lunch, snack, dinner, snack. Now this should be planned before your surgery. So you should work, if you have a surgery date,
Yeah.
obviously some surgeries are hard because they're emergency,
Yeah.
but a lot of the time is you plan, my surgery is on the 10th of May,
Yeah.
okay?
Yeah.
So you should have your dietitian and physio at least 2 weeks before your surgery,
Yeah.
and you should have a plan for at least the first 3 to 4 weeks after surgery.
Yeah.
Because if you are guessing,
No.
it's not going to work.
No.
You don't have time to cook,
Yeah.
you won't have energy to cook.
Yeah.
So you have to make sure that the meals are planned, you have foods that you like and enjoy,
Yeah.
and they're easy for you to get, and they're ready prepared.
Yeah.
Okay?
Yeah. I think it's that's true because mostly people do the surgery. They still have time. They know the date, unless there's emergency. But most of them like knowing the date they're going to do the surgery because have to decide. Some people like decide to not surgery or do the surgery. So still have time to plan. Yeah, and that's a good recommendation. How about like other thing that help with the inflammation?
Yeah, good question. So first, protein. Your body needs more. So by more, I mean maybe to maintain muscle mass,
Yeah.
you need, if you are 60 kilogram weight,
Yeah.
you need 1.5 or 1.6 gram per kilogram of body weight,
Yeah.
which would then mean you need maybe 90 grams of protein a day. Yeah?
Yeah.
Which is, you can achieve through food. 3 eggs in the morning is 20 grams.
Yeah.
Then maybe you have lunch with big chicken breast, another 20-30 grams.
Yeah.
And then dinner with beef, lamb, chicken, again another 20-30 grams. So you have almost 90. If
Yeah.
you have a few snacks in the day, some dairy, glass of milk, you're close to having the 90 grams in the day.
Yeah.
Now, when your body is acute surgery, we aim for 2 to 2.5 gram per kilogram
Per kilogram.
protein. Okay, so now if you are 60 kg, you need 120 minimum.
Minimum.
Now if you are 70, 80, 90 kg, you need almost.
More than that.
So now you need to think, okay, I need supplements.
Yeah.
Yeah, and you want to choose whey isolate supplements that your body can tolerate and that you've tried before. And you may need for the first 2 or 3 weeks 2 supplements a day,
Yeah.
because it's very hard to get that through food.
Yeah.
Yeah.
To get enough protein through food.
Exactly, yeah.
Especially after surgery and you feel not they really want to eat much as well.
Yeah.
Yeah.
The second thing for inflammation actually is fiber. Comes from vegetables,
Yeah.
fruits, yeah, quinoa, grains, nuts, and
Nuts, yeah.
seeds. These have anti-inflammatory properties, which actually feed, and they have bacteria, and they actually feed the gut microbiome. The gut is one of the most important things to help fight inflammation
Yeah.
and to support it. So inflammation is important, like you want inflammation. If you
Yeah.
go to the gym, you want to damage the muscle
Yes.
so then it can recover and repair, right?
Yeah.
So it's the same with the surgery. The idea is that you want that inflammation to go well.
Yeah.
The issue is if the inflammation stays too long, you increase risk of infection, impaired healing,
Yeah.
impaired wound healing, delayed muscle recovery. Yeah.
Yeah.
So these are the things we want to avoid. So to make sure your body is well prepared, we want to make sure we're getting enough fruit and vegetables, and you have to aim for a rainbow. Yeah.
I
You have to
see.
you can't just have the same broccoli and spinach every single day. You have to have carrots,
Yeah.
tomatoes, broccoli, nuts,
It's more
seeds,
vitamin.
beetroot. Yeah, because every different color of fruit and veg has different vitamins and minerals. And the more you have over the whole week, that doesn't mean you need to have every fruit every single day,
Yeah.
but the more you have over the whole week, you can train your gut and you can train your gut microbiome
Yeah.
to recognize and feed that good, nice bacteria,
I see.
and then that in turn feeds your immune system as well.
Mm.
So it's important to try and get lots over the whole week. Okay.
I see.
Now, in the acute phase post-surgery, sometimes we might like to have more red and dark currant and berries, cherries, strawberries, raspberries, blueberries.
Like berries.
Yeah, because they contain a little bit more polyphenol content, and we can increase the amount of these we have, and they can help support that recovery post-surgery as well.
I see.
And that doesn't mean you have a big bag of blueberries, but it means you may have just a little bit more than you may normally have, and that's the first challenge, okay?
Okay.
Because your energy, your calorie needs can also be higher after surgery as well.
Yeah.
And that can range, like an athlete, somebody who's very fit, their energy needs can go up by maybe 200 to even up to 600 to 800 calories a day.
Yeah.
In that acute phase.
Yeah.
Depending on how big the surgery is.
I see.
Maybe if it's a small operation on the ankle versus an ACL injury versus a hip replacement versus a gut surgery. The gut surgery is a bigger surgery, so that may need more energy after. Whereas the small surgery on your toe, that's going to heal more quickly and it's less invasive, so that might not need as much. So it depends on which surgery you're having as well.
I see. So how about collagen after the surgery?
Yeah, good question.
As we call skin, because we love the beauty, you know. Everyone don't want to have a bad scar or want to have like a healing quite fast. Is that collagen have an impact on that?
Yeah, so the studies for collagen and injury, the good studies are all done in elite athletes and sports people. Okay, and they find that if you supplement with collagen, 20 grams of collagen with vitamin C around the surgery date and for the week, 2 weeks after surgery, it can improve healing time, improve recovery time, and improve wound healing time. Okay, so with supplements, you have to get the quality and the quantity. You can't just buy any old supplement. The ones that work are more expensive.
Yeah.
If you're an elite athlete, you need to make sure they are third party tested because you are being drug tested.
Yeah.
So you need to make sure your supplements are also tested, that there's no contamination or cross contaminants in there. If you're taking supplements, that should be planned.
Yeah.
Timing, what time with food, what dose. Every individual may need a different dose.
I see.
Because somebody bigger, 100 kg, may need double.
Yeah.
Yeah, okay. So it's working on in the same with physio.
Yeah.
It's not one size fits all approach.
No.
So we have guidelines and recommendations.
Yeah.
But actually then you take them and then you then apply them to the individual. The other supplements I recommend for surgery is creatine.
Yeah.
So we do creatine loading before the surgery and then continue with 20 grams after surgery as well for the first 5 days.
I see.
Creatine is an energy store. So your body has different energy systems. So that first fast-acting phase is the phosphocreatine phase. So your body's using the short creatine stores in your muscle.
I see.
So it's used as energy for the recovery process and the healing. Okay, so and actually it has some anti-inflammatory benefits as well. So making sure you run the right dose of creatine before and after your surgery is important. You should practice this before your surgery because people have different side effects.
Yeah.
Some people get gastro side effects. Some people have a lot of water retention. So if you've never had it before, you should at least speak with your registered dietitian or nutritionist to make sure that you're tailoring the right dose.
That's why you need to plan.
You need to plan,
Otherwise, because it's a lot of work, and then actually it's really help you, and then easy for you after surgery, and then you feel like, okay, this surgery going quite quick recovery. Yeah, and then okay, after this phase it's gonna be rehab phase.
Yeah.
It's work a lot with physio. Like they come like I told you, like the sleep sometimes is sleep also affect with the rehabilitation, also nutrition, also affect. So after the first phase, that before rehab, that's what we recommend. And during the rehab, do we need to change any nutrition or any specific?
Yeah, good question. So on a general level, yes, we do. Yeah. So the protein now can drop maybe to 2 gram per kilogram, but we keep it high.
Yeah.
In the rehab phase, we still need some carbohydrates, But if you're an athlete, we don't want to give you too much now, because we don't want you to put on extra weight and fat mass. So we want to make sure you're getting the extra energy from the protein and the fiber to make sure that muscle rebuilding is coming from the right type of energy. And having some healthy fats and increasing salmon and oily fish and chicken and red meat, lean red meat, to make sure you're getting good sources of iron and good sources of omega-3 from the foods that we eat as well. We also want to think now about timing, because the most important thing of the rehab is for you to have a good physio session. The better the physio session, the better the recovery is going to be. And we want to make sure that is going to continue. So before the session, we might have a little bit of carbohydrate to give us some energy for the session. Then after the session, we may have a little bit of carbohydrate and protein to have the recovery. You want to have a little bit of both, because when you do exercise, you use carbohydrate. So you want to replenish that fast to stop your body using the muscle. And you want to pair it with a little bit of protein as well.
I see. Some, I saw in the internet or whatever, is IF, they call intermittent fasting during your exercise. I don't think it's good for people who do the surgery or normal people.
Intermittent fasting is good if you're very obese. And if you're very overweight.
I see.
It's an intervention, you know. You wouldn't prescribe a ACL rehab plan for somebody with a shoulder injury. You would give them a different. So intermittent fasting, if somebody is trying to lose weight and they are overweight or obese, it's a good method. If somebody is fit and healthy and they are trying to improve their fitness and their body composition, I don't recommend intermittent fasting, because actually it can affect your hormonal balance based on your age. It can affect risk of injury, affect immune function, and it can affect your body composition if it's not done correctly as well. Because what people do with intermittent fasting is they think, oh, what I do is I eat what I want one day and then I just starve the next day, then eat what I want and starve. That's not a well-balanced diet.
I see. And what they call, so how many minutes before exercise to take protein or carbohydrate?
Good question. It depends on the session and the type of exercise you're doing as well. So let's say you're going for a strength session. These sessions tend to be not as energy expending, so you don't necessarily need a lot more, you just need a little bit. So you can even have maybe 1 gram per kilogram of body weight just before. So if you're 60 kg, you may have 60 grams of carbs, you know, and then you could have 0.2 grams of protein, so that might be then 10 to 20 grams of protein with that. So it very much depends on the person. You have to practice with it. You can train your gut. So what you'll find is start with something small, see how you feel. You know, rice cake and some peanut butter, half a protein shake. See how your gut is. If you tolerate okay, next time have a little bit more. If you feel a bit bloated, just stay with that for now. In terms of time, so if you are 4 hours before, you want to have your meal. That might be your oats or your sandwich or whatever you have for your meal. And then 2 hours before, you want it to be easily digestible. So it may be more like liquid, you know, like a drink, like a shake, like a jelly, something that's going to be easily digestible. And then if it's maybe 10 minutes before, you want it to be fast acting, like you can be like a glucose drink, which is quickly, or energy tablet.
I see.
Something that's going to, or jelly babies, something that's going to give you instant sugar.
How about like amino
acids?
Amino that.
BCAAs?
Yeah,
BCAA is cool. So if you are getting your protein from food and you're getting enough, then the BCAAs may not make as much difference. BCAAs can be helpful in those with disease who are struggling, being able to digest and absorb the protein well. Somebody maybe with liver disease, advanced liver disease, with gastrointestinal disease, somebody with a burns injury, they may benefit from BCAAs. If you can get enough protein from this diet and supplements, then you shouldn't need to have the BCAAs as well. It's just extra.
It's just
extra, and it may not work. So I would save your money. But that's very individual. If you look at the research, you know, when you do research, it works there's always like it worked for 70% of the people.
Yeah.
Why didn't it work for the other 30%? You know.
Yeah.
There must be another confounding factor. So with the BCAAs, the research is like 50-50. So if you can get enough from diet and you get enough from your supplements, because your whey protein has the BCAAs in it.
Yes, that's true. I
And
already
actually,
have that.
and that's the whole point.
Yeah.
And BCAAs are very expensive. And they have very good marketing teams. So unless it's been advised to you by your sports dietitian or nutritionist that it would benefit you based on your context,
Yes.
I would say food first, and then I would just have a whey protein supplement after that. It's a good win, yeah.
Okay, so now for in rehab phase, so after rehab, you should take protein right away, or you can wait for a few hours?
Yeah, good question. You can wait for a few hours, but it can then impact how much you then have for dinner. So yes, you can wait. You don't have to have it straight away. You know, you don't have to finish your rehab and then down the protein straight away.
Yeah.
You don't have to do that anymore. But it's if you finish your rehab session, if you then don't have dinner for 3 hours, then you try and have a protein shake and a big dinner.
Yeah.
You may have your shake and have less of your dinner.
Yeah.
So then that might mean you're not eating enough total through the whole day.
I see.
Whereas if you have it after your
Session, yeah.
it means that you're less likely to miss it and still have a good dinner as well.
I
So
see.
it's more about when you time it nicely through the day, it's more about it's easier to consume, it's easier for the body to digest. The second thing is having carbohydrates and protein after your session does improve recovery, because what you want to do is if you've got a session today and then you've got another session tomorrow, you want to maximize how much energy you have for each session.
I see.
So I always recommend to try and have it within the first hour after a session.
Yeah.
And it's easy, you know, you can just take it,
Yeah.
a few sips,
Yeah.
and then carry on
Yeah.
through the day. It's not as if though you have to down it in 30 seconds and like have it like a beer and like it's nice. So I always recommend, and I always recommend a little bit of carbohydrates as well with your protein.
I see.
And it doesn't have to be a protein shake, you can have food, you can have a bar. Oat-based flapjack bars are a good snack to have after. You know, you can have some. If you've got sushi nearby, have some sushi.
Yeah, that's
It's
true.
good protein, omega-3 and
Yeah.
rice as well is easy
Yeah.
to. Only 2 or 3 pieces is a good snack. So you can be creative. It doesn't have to be shop bought, or it doesn't have to be a whey protein supplement. When you work with a dietitian, they can find out what you like, what foods you enjoy, and give you recommendations based off what you want, you know, rather than just random copy and
stuff.
paste.
Yeah, that's really good advice, because it's a lot of people like scared as well, like no, I don't want to eat this, it's too much carbohydrate. In a lot of in diet thing, I heard a lot about like, no, I don't want to eat a carbohydrate.
Yeah,
Just scared of
I
carbohydrate.
know. It's so bad. They're so important.
Yes.
They're so important. Everybody hates carbohydrates. I don't know why. What have they done? Like, high fat, high sugar foods can be, if you have too much of them, they can be bad for you.
Yeah.
They can cause health issues. But you know, like, it's nice to have. It's
Yeah.
okay.
Yeah.
And if that's all you can eat, that's all you can eat. End of the day, it's better to eat something than to starve.
Yeah.
That's number one. Then if you can eat, can you eat something that's a little bit better for you? Yeah, that's gonna have more nutrients. Sometimes you don't want food that's nutritious. You know, if you're going for a boxing match,
Yeah.
you need sweet, sugary things.
Yeah.
You need sugar, you need glucose, you need carbohydrates.
Yeah.
If you're high intensity, you need the carbohydrates. So it's
Yeah.
the same in surgery. Surgery is high intensity. And carbohydrates feed our immune system, you know, and they feed our brain. We need glucose for our brain energy, for our muscle energy. And ketosis can be useful for maybe a short period of time, but long term, there's no, you know, there's no benefit.
I see. I agree with that.
Yeah.
No benefit. So actually, we just eat what we love, but just what like, okay, this amount of this. Yeah.
If you're injured and you're going for surgery, that's a different phase. you know, if you're a boxer or you're a footballer,
Yeah.
when you are in season, you are working.
Yeah.
So when you're working, you need to make sure you're doing the best to get the most out of your work. When you're relaxing, relax and enjoy.
Yeah.
So and the same with nutrition. When it's for something, you need to change it.
Yeah.
When you're not training for something, enjoy in moderation.
Yeah.
Yeah.
Enjoy. We call like flexible.
Flexible dieting. Yeah, exactly. It's okay to be strict when you need to be.
Yeah.
You know, you have a wedding coming up and you want to lose weight, so you get good for wedding.
Yeah, that's true. Okay. So we talk about what you should eat already.
Yeah.
So what we should avoid, even before surgery, right after surgery, and in rehab phase.
The most important thing to avoid pre-surgery and post-surgery is alcohol.
Yeah.
Number one. Avoid alcohol during surgery. Do whatever you can to avoid alcohol.
Yeah.
It will delay your recovery and your rehab.
Not even how about just one glass of wine?
Just avoid it if you can. Look, if you really need to have some.
Yeah.
But if you're a professional, avoid it best you can.
Yes.
Because true. When you're recovering from surgery, you want to do the best for your body to recover the best. Alcohol will destroy that. 1 or 2 beers, 2-3 glasses of wine.
No.
Yeah, it's.
Cut it out.
Yeah.
Just not having
Just don't have it.
Best.
End of the day, if you can't not have alcohol for 8 weeks, then that's another problem that we need to talk about.
Yeah.
It's okay to drink when you want to, but if you should be able to go, actually for 8 weeks I can't drink.
Yeah.
That's okay. Like you should be able to have that control over it. Like I don't want to, or don't have any alcohol for 2 weeks.
Yeah, just actually just for yourself. You
Yeah,
know?
yeah.
You need a perfect recovery, fast recovery. You should do this for yourself.
Yeah.
And this is from my question. It's about coffee.
Yeah.
Yeah. Is that coffee affect anything on the surgery, like delay, anything? No.
Yeah, and coffee can actually help because with surgery, you can feel low mood, and you don't have the mental stimulation. And actually, rehab is not physical; it's cognitive.
Yeah.
Because you're trying to relearn.
Yes.
How to use the muscle.
Yes.
So actually, caffeine is a stimulant for the brain.
Yeah.
So actually, having maybe a coffee half an hour before your rehab session, can maybe improve concentration, focus.
Yeah.
To make sure you can really feel effect.
Yeah.
The only time caffeine can be negative is if you have it too much late in the day, because then it affects your sleep.
Yeah.
If it's affecting your sleep, that's going to affect your recovery.
Yeah.
And then the only third time I say to reduce caffeine is if you have IBS. Because if you have IBS, caffeine is one of the biggest stimulants and triggers for IBS. And if you have IBS and you're drinking lots of caffeine, you're causing gut inflammation.
Yeah.
And you're then not absorbing all of your nutrients properly because you're pooing them out.
I see.
So if that's happening, then that's going to impair your recovery and your rehab as well.
I see.
So there are some people who may not tolerate it as well. There are different types of caffeine. So you can get caffeine through coffee.
Yeah.
Caffeine in coffee causes the most effects.
Yes.
If you have it with a chewing gum or a sweet, it's going to cause less gastro effects as well. Okay? So you can always manipulate the type as well if you feel as though you really need it and you need it.
I see. So to be clear, that caffeine, not a bad thing.
It's not a bad thing for your recovery, not at all.
No.
And it can, if you like it, have it maybe an hour before your physio session, especially the days where you cannot be bothered.
Yeah.
There will be some days in your recovery where you cannot be bothered. You don't want to go, you don't want to speak to the physio, you don't want to look at them, you don't want to move your leg.
Yeah.
So those are the days it's always good to have a little bit of caffeine as well.
Yeah, because I'm also use the caffeine for my concentration.
Exactly, yeah.
That's made me more can focus, like when I sip and then do some tasks. That's really helpful.
Yeah.
And now this is about Thai people that we say, like some people say after surgery you should not take eggs, you cannot eat eggs because it's a bit effect on the wound. Is this true or not?
I've never had this. Okay. So the only time I have had this, so I used to work with a team where they used to do the liver transplant when people get liver failure.
Yeah.
So after liver failure, in the UK, the eggs, they never used to have like a process to make sure that they were clean, free from any birds that may give you infection. So we used to say avoid eggs for the first 6 weeks, but that was because you are on medication called immunosuppression. Immunosuppression and very high dose, so you're more likely to get infection. We used to say avoid fish. We used to say avoid dairy because it can give you listeria, food poisoning, E. coli.
Yeah.
Now that advice has changed, where you can have egg, but make sure it's cooked through. Scrambled egg, omelets. Avoid the very runny egg and make sure good food hygiene.
I see.
So I still recommend that post surgery. Make sure you keep good food hygiene, because if you get food poisoning, you don't want that
No.
after surgery. And if you have a big surgery, you're gonna maybe be on steroids and immunosuppression maybe.
Yeah.
Not all surgeries, but then if that's the case, then you should obviously work with your professional, and you may need to follow an adapted diet. But otherwise,
No.
I don't know how it affects, because you need the protein. It has so many vitamins, minerals, and protein.
Yeah.
Yeah, it's good.
There's a lot of like, some of my relative or something like that. They say like, oh, don't eat eggs. They're like, no, eggs is a good source of protein. You need it. It's nothing epic. It's just like, no, it's effective on it. It's not. Yeah, but they still have like, for I don't know how many years ago that they believe in that.
It's hard to change,
It's hard to change it.
Yeah.
How,
So many years ago, they didn't have the phone to watch this video.
Yeah. So now, yes.
Yeah, so it's hard for people to adapt and change.
Okay. So that's all for today. So can you do like recap the key point that we're talking about today?
Yeah, good. So when you have a surgery, it triggers high stress for your body. It triggers high immune response, okay, and high demand. So your body now needs more energy to help it recover. You should think about your nutrition before your surgery and after your surgery, okay? And you should have a plan in place, especially for maybe the week before and at least the first 2 weeks after, to make sure that it's a smooth recovery process as well. Yeah. Your body likely needs extra energy and protein.
Yes.
And a lot more. So it's important to have supplements to help you out, because you may not be able to eat as much. As you go into the rehabilitation phase, we may need to change it a little bit, and timing the amount and what you have with your physiotherapy. Okay. The aim of nutrition is to help with the physio recovery.
Yeah.
Help give your body the right vitamins, minerals, energy, protein for the wound to heal and the muscle to rebuild, and to minimize how much muscle mass you lose.
Yes.
That's the 3 key aims of the nutrition. It doesn't happen overnight. It takes planning from before your surgery and all the way through, depending on what type of recovery you're doing. If it's an ACL, that might be 3, 4, 5 months,
Yeah.
If it's a small surgery, maybe a little bit less than that.
Less than that.
Yeah.
Yeah. That's really important to have the expert with you to guide you through this, not just Google by yourself and then try to guess it, because you never know. Expert work with a lot of people, a lot of cases. They can adapt to go with you, and then also can maybe design your favorite food and still healthy, and then help you through this surgery as well.
Everyone is an individual, so you need a personal approach, because you don't know what you're missing. Even if you ask ChatGPT, you don't know what you're missing, because you don't know what question to ask.
That's true.
How do you know if you're asking the right question? And how do you know if ChatGPT is giving you the right answer?
The thing is with ChatGPT, sometimes they give you all information.
Too much?
Yeah. And then it's like, sometimes I just like try to ask ChatGPT, and then they give me the answer that feel like, no, this is not updated information. This is really old information. And then they come back to me like, yeah, you are right. This is new information. It's just like, okay, if someone who don't know about this go do the ChatGPT, and then the first answer, they believe it. you know, because you have to research deeper. It's hard in the medical way. Please not use ChatGPT. Okay, so today, thank you for your time, and then I got a lot of information. It's really deep down, so I can also like suggest to my client. But the best is they go to dietitian by themselves to go through this and do the best. Remember, avoid the alcohol. That's I always tell my client as well. Even not surgery, you go through inflammation, avoid the alcohol. So thank you so much for today.
No worries, thank you for
I
having
really
me.
enjoy it. We really thank you to Bali to keep information, and for people who struggling with the recovery phase about the nutrition, and of course with rehab with us Physio First Phuket. Thank you. Bye bye.